My name is Ben Appenheimer, and I am the Associate Clinical Director of the Division of Infectious Diseases. When I was looking at fellowship programs, there were several key aspects that I considered, including the clinical training, research opportunities, location, and personal fit. It is my goal today to give you a brief overview of our different clinical services and show how these services will help serve as the backdrop for your clinical training in infectious disease, providing you with a well-rounded fellowship experience. One of the goals of our program is to provide an excellent, comprehensive clinical experience for our fellows. Our clinical rotations give the fellows a broad range of experiences in different learning environments, leaving our fellows feeling well prepared for clinical practice after fellowship, no matter what career path they choose. From an inpatient perspective, we have 3 different general ID services, 2 at the University of Iowa and 1 through the VA. One of the university services is what I consider the classic academic teaching services, with a large team of medical students, residents, fellows, and attending, pharmacists, etc. This gives the fellows a chance to experience leading and managing a team, including the opportunity to teach learners, and helps prepare them for a job in academic medicine if they so choose. The second is a service that I think is relatively unique to our fellowship program, and this is a lower volume service where the fellow gets to work one-on-one with an attending, which allows for greater autonomy and individualized learning. This service is lower volume by design to allow the time for individualized teaching of each of the fellows. Our third inpatient service is our VA inpatient service, which we also combine with an outpatient rotation. The outpatient rotation includes seeing new ID consults, as well as taking urgent calls and add-ons in clinic. We have been told that this rotation mimics private practice, where you're balancing a small inpatient service with outpatient responsibilities. In addition to that outpatient experience, we also have 2 continuity clinics, one in general ID and one in HIV. For our patients living with HIV, we have a multidisciplinary Ryan White clinic. As a fellow, you have your own dedicated panel of patients where you provide the continuity and they identify you as their doctor, as opposed to rotating through attending clinics. Our clinic is truly multidisciplinary with dedicated pharmacists, social workers, an HIV program nurse, and a behavioral health team to help holistically care for these patients and work to keep them engaged into care. One question that comes up a lot is what breadth of diseases are seen here at the University of Iowa. Given the size of the community we are in, there's a common misconception from those who are not familiar with our hospital that this is a small community hospital. However, our hospital has around 800 beds, which puts it on par with many other large academic training centers. Our catchment area includes a large portion of the state, along with some areas of western Illinois, providing a relatively diverse patient population. We get a lot of exposure to what one might consider bread and butter infectious disease, but also see enough zebras to keep us on our toes and help keep our differential diagnoses broad, which in turn provides an enriched learning environment. To further improve the breadth of infections that our fellows see, they have dedicated time to rotate on our transplant ID service, where we take care of solid organ transplants, including lung, heart, liver, and kidney transplants, stem cell transplants, and those receiving CAR T-cell therapy. Fellows rotate on this service for at least 2 months throughout their fellowship, with the opportunity to do more weeks if desired. Our transplant ID service has a very close working relationship with the transplant medicine and transplant surgery teams, using a collaborative approach to care for these patients. We also get exposure to microbiology in a variety of settings. We do a dedicated 2-week micro-rotation in the first year of fellowship to understand the basics of how the microlab works and get to know the people in the lab. We then have twice-weekly micro-rounds, during which we review interesting active cases and have didactics presented by the microlab staff. The micro staff is very interested in and adept at teaching, even joining our ID grand rounds to share their expertise. For exposure to topics that we don't come across frequently in the hospital, we have a 2-year didactic curriculum to help solidify our knowledge on what we see commonly and also expand our knowledge to cover any gaps that might exist. Through this combination of clinical experiences and didactics, our fellows come out of fellowship feeling extremely prepared for clinical practice. A common comment of our graduating fellows is that they feel very comfortable with their ability to transition to unsupervised practice due to their clinical experiences and mentoring during their fellowship here. A few general points that I wanted to make as well. First, I want to touch on the community, as this was a significant factor for me when I made the decision to come here for fellowship, and then again when I decided to stick around for my career. Iowa City is a relatively small but very livable community with great schools, very little traffic, extensive bike trails, and lots of parks. Being a university town, it also has some of the benefits of larger cities, including great diverse food, high-level athletics, musical performance, etc., while maintaining the small town feel. Second, I wanted to talk about the flexibility and constant reevaluation that we do of our program. I view this as one of the significant strengths of our program, being the willingness to adapt the fellowship program to suit the needs of our fellows. We take our program surveys to heart and use the results of these surveys as a starting point for a yearly meeting with the fellows and faculty in an open forum where we receive feedback on the experience of the fellows. Over the past few years, we have made several programmatic changes after these meetings, including increasing exposure to microbiology, antimicrobial stewardship, and hospital epi, and working to offload some of the clinical services to better balance service and education, which we feel is extremely important. We are constantly evaluating our program from within and working to improve it where possible. In conclusion, while I'm admittedly biased, I think that the University of Iowa would be a great place for you to do your fellowship. The training program provides a strong clinical foundation with a variety of learning opportunities and a diverse patient population. The town has a sense of a small town living, with some of the benefits usually reserved for big cities, and the people associated with the program are truly focused on providing every fellow with a great learning environment.